Thanks, everybody. Hi, I'm Marcie Parkhurst from FSG. I am so grateful to be here with all of you today. We were, when we did this exercise this morning, and we had to line ourselves up on how, I forget exactly the wording, how close do you feel to, the community that you work with or whatever. It's sometimes hard for me because I'm a consultant, so I really enjoy people. I like to build relationships. I like to talk with people, but I don't always feel it coming in. So I'm really glad that we had the morning session, because now I feel like, one of the group. I feel like you are my people. This is great. So thanks very much to IOM for having me, and for other folks who invited me, and it's great to be here. So I want to talk to you about three things today: complex problem solving, collective impact, and evaluation. So first, recognizing David's joke here about evaluation after lunch, I want people to stand up if they have heard of collective impact. If you've heard of collective impact, stand up. Okay, awesome. If you think that you know what collective impact is, give a clap. And if you think that you could accurately explain exactly what collective impact is to the person standing next to you, I want you to give me a woohoo! All right. That's kind of what I thought. Okay, you can all sit down. Thank you. So given that I'm giving a very brief overview today, I'll just mention that there are a bunch of resources that are on FSG's website, on the website of the Collective Impact Forum. I left a couple of things printed out on the table, but it looks like it got scooped up, so that's great. So I'm going to go at a pretty high speed here, but feel free to get in touch with me afterwards or look to those resources to backfill. So a couple quick words about FSG. We are a nonprofit consulting and research firm. We're based in Boston. We have an office here in DC. I live here. We work on strategy, evaluation, collective impact, shared value, lots of stuff that at its core is all about trying to address the world's most complex social and environmental problems. Not very ambitious. So we do lots of stuff. We do one-on-one consulting with clients. We do a lot of thought leadership. And we try and talk to and work with as many folks as we can to learn from you, and to try and kind of germinate lessons across the sectors that we work in. So I wanted to start with a reflection from kind of my experience being with you this morning, which is that it's been amazing to me how many times we've talked about trust, about relationships, about inclusion. And that's not often my experience when I go to events or workshops that are specifically focused around evaluation. But it was delightful to me. So that's great. So we're talking about trust and relationships and stuff. But when people think about healthy communities, and someone else mentioned this earlier today, a lot of times people are thinking about ultimate outcomes. What's the childhood obesity rate? What's the teen pregnancy rate? What's the infant mortality rate? All of these rates, all of these numbers. So I think what we need to think about is, how do you get from knowing that trust and relationships and all of that soft stuff is super important, that's like what it's all about, how do you translate that knowledge or that kind of intuitive understanding to actually trying to get at those ultimate outcomes and those metrics and rates and all that kind of health stuff that we do know is very important. So that's what I want to talk about. How does that change process work, and how might you start to think about evaluating it? And I've got 11 minutes left, so let's go. So the first thing I want to talk about is how there are different types of problems in the world. And I think one of the things that we struggle with in general in the social sector is we're kind of stuck in a rut of treating everything like it's a simple or a complicated problem. When I say a simple problem, I mean like baking a cake. You follow a recipe, you get the cake, as long as you don't leave the oven unattended. Putting on a Band-Aid, these are things super easy. It's a product, you apply it, you follow the directions, it's done. There are complicated problems too, where the answer is not as clear. You don't have instructions. So if we need to find a vaccine for malaria or Ebola, this is not an easy or simple problem, but it's a complicated problem in that once we find that vaccine for Ebola that works, we can mass produce it, we can give it to people, and it will work over and over again until there's some kind of mutation. Then we've got complex problems like community health and some of those other things that I talked about, obesity and teen pregnancy and things like that. And we can't expect the solutions that we use for complicated problems, or the processes that we use for complicated problems, to work for complex problems. This is why we were talking about trust and relationships and all that stuff this morning. You don't need trust and relationships to develop a vaccine. But you need trust and relationships to improve community health and to solve any of these other kind of large-scale, complex social and environmental problems that we think about, like education, like criminal justice, and all that kind of stuff. So, like I said, we've often treated these problems as simple or complicated, and that's not really working. So what we talk about when we talk about collective impact is that it is an approach, one approach among many, to addressing complex problems. And the exact definition of collective impact that we use is that it's the commitment of a group of important actors from different sectors to a common agenda for addressing a specific problem. So we heard from the folks in Spartanburg this morning. It sounds like they have a lot of folks who are from all across the community. We've got folks from the hospital, folks from the nonprofit sector, and they've all come together and they're kind of trying to think about how to improve their community. So these are, some of the formative elements of collective impact. Collective impact is not something you need to use when you're dealing with a complicated problem. It's just not necessary. It's like, having 17 people trying to screw in a light bulb. You just don't need it. So it's not the thing that's right for everything, but it is an effective method for complex problem solving. So real quickly, there are 5 elements of collective impact. These are all very important, and we kind of refer to this as the design specs for this process. And I call it a process, and I think that's important because when you're dealing with complex problems, there's no product that you can go get or find or make or replicate that's going to solve that problem again somewhere else, because it's all context specific. And David talked about this. Context is so important when you're thinking about complex problems. So these are the specs for what that design process looks like. And I won't go into these because we've got limited time, but you can kind of read about the definitions of these elements of collective impact. This is an example of what a collective impact initiative structure looks like. It looks pretty well organized because I like to make pretty slides if I can. But you can see that this is a complex undertaking. And all of these kind of little bubbles over here are all referring to organizations, individuals, leaders in a community who are involved in this massive initiative, which in this case was about workforce development in the city of Chicago. So this is what a collective impact initiative kind of looks like. So now that we've kind of got a brief understanding of that, I want to talk about how you evaluate something like collective impact. And we just put out a paper that I co-wrote with Hallie Preskill from the American Evaluation Association, well, previously of the American Evaluation Association. She's now with FSG. So you can get, again, more detail on this there. So the first thing is that evaluating a complex problem-solving initiative like collective impact requires a mindset shift for a lot of folks. And based on my conversations with people here this morning, this may not apply to many of you in the room, but you're going to work with people for whom this is relevant, or you're going to be funded by people for whom these mindset shifts are necessary. So I'm just going to go through them quickly. So one is the shift from assessing the impact of a specific intervention to assessing multiple parts of a system, including all of its components and connections. So if you're going to be looking at a community-wide initiative to lower rates of teenage pregnancy, you're not just looking at one program that the YMCA is running. You're looking at what is the YMCA doing, what are the schools doing, what are the churches doing, what are parents doing, what are after-school programs doing, all kinds of folks, and how are they all relating to each other, right? Next, you're not just evaluating the effects and impact according to a predetermined set of outcomes. You've also got to look at what's emerging over time. What are the unintended things that are happening, both good and bad? And what does that mean for your initiative going forward? It means that you can't necessarily use logic models that imply cause and effect and linear relationships because things are complex. How many of you have a logic model for your children? You don't have a logic model for your kids, but you know that you are, doing the best that you can. You've got some guidelines that you're using. You're trying to check your progress as you go. You course correct when you need to, have a little sit down, but you don't have a logic model. And I think that's something that's useful to keep in mind when you think about complexity, is whether or not you have a logic model for your child. And then lastly, we're not talking about providing findings at the end or only at the end of an evaluation. We're talking about embedding feedback and learning and continuous improvement and adaptation into the DNA of an initiative and doing it over and over on an ongoing basis so it becomes part of what you're doing every day. So when we talk specifically about evaluating collective impact, we suggest looking at 4 different levels of that initiative. We're going to start with the context, because again, with complex issues, we think that is the most important part. It's the most influential thing. When somebody was talking this morning about how they think solving a problem is like swimming in the ocean, and the currents can change all the time. And we were like, yeah, the currents can change all the time. We're talking about context when we're talking about those currents. So there's some examples that we give here about what does that really mean. It means community culture and history, economic factors, political context, and as David mentioned, this is stuff that changes independently of and as a result of these complex initiatives that you may be involved in. The second thing is to look at the initiative itself, and this is where we get to the trust, the relationships, the capacity building, the other kind of stuff that's happening within the context of the complex problem-solving process itself. And a lot of people don't want to hear about evaluating process. Again, they want to know about, are your ultimate outcomes changing? And okay, maybe you can't tell me yet if the ultimate outcomes are changing, but is the program being implemented? Or, what's happening with the funding? But you've got to look at the initiative itself. You've got to look at the relationships, how willing people are to learn. There's a lot of stuff that's embedded in here, and in the guide we offer a set of kind of sample outcomes and indicators, and there's probably close to 75 of them that you can look at that are all related to these things around the initiative itself. So the third thing is the systems that are targeted by the initiative, and this is sort of what mediates how you get from the problem-solving process to the actual ultimate outcomes, is you've got to change those systems in the middle. And when we say systems, we talk about patterns of individual behavior, we talk about funding flows, about cultural norms, about policies. So there's a lot of big stuff in there. Not everything that's on that list is something that every initiative is going to target, but a lot of it is very important for a lot of these different complex initiatives. And then lastly, the initiative's ultimate impact. And this is where you want to look at those kind of ultimate outcomes and the things that you do definitely want to change at a population level at the end. So here is the way that we illustrate. This is classic, isn't it? 3 PowerPoint presentations in a row, 3 frameworks in a row. You guys are going to be like, oh my God. So this is the way that we represent the collective impact theory of change. And the slide after this kind of layers on the evaluation framework for it. But what we've got here, circle number 1 is the context. Circle number 2 is the initiative itself and the kind of capacity and the learning culture and that kind of stuff that I talked about. Circle number 3 are the intermediate outcomes. These are the systems change and behavioral change that I mentioned. 4 are the ultimate kind of population level outcomes. And these orange arrows that are just kind of waving across the page, that's where continuous learning comes in. Because we recognize that what happens in box 3 influences box 2, and that influences box 4, and all of these things are sort of connected. So when we layer evaluation on top of this, and this is now along the bottom, what we're looking at are both ongoing performance measurement activities in orange, and by performance measurement activities, I mean just sort of ongoing monitoring. Are you doing what you said you were going to do? Are you making progress towards those ultimate indicators? You look at the same thing over time, right? And then in addition to that, if you want to understand why those things are moving or not moving, you've got to do some evaluation. And there's different approaches to evaluation from a kind of more technical standpoint, developmental evaluation, informative and summative evaluation, and we can talk more about that stuff if you guys want to. So I'll just mention that we think it's really important to think intentionally about the type of evaluation approach that you use when you're first getting into an initiative, and Carrie, you talked about this a little bit. So you've got to be specific about what stage of development is your change initiative in, and what does that imply about the kind of information that you need, the way that you ought to gather it, how in-depth you want it to be, who you want to be involved, and all those sorts of questions. And there's some more sample questions here. So almost second to last, I wanted to give you a quick example of an initiative called Shape Up Somerville. Has anybody heard of this initiative? Okay, a couple people, great. So it's a city-based, it began as childhood obesity. It became a broader kind of community obesity change initiative in Somerville, Massachusetts. And it was operated in part through Tufts University, and so it was very rigorously evaluated kind of over its lifetime. And I just want to point out some of the systems changes that this initiative targeted, and some of the ways that they thought about getting at this very difficult issue of how to influence obesity outcomes. So some of the changes that they tracked were increasing funding for anti-obesity work across the community, getting healthier menu options in the public schools and at more than 40 local restaurants. They made investments in new bike lanes and investments in public parks. They improved nutritional standards in the public schools, and they improved the physical education equipment, facilities, and activities in schools and after-school programs. So that kind of broad cluster of change that involved, the public sector, the private sector, many of the nonprofits in the community was super, super important to actually getting those obesity rates to drop. So a couple of key takeaways here. One is we really encourage partners in any kind of complex change initiative, collective impact or otherwise, to embed evaluation throughout the initiative. So that means, first, that it's really important for people to embrace the practice of continuous learning and adaptation. We really encourage people not to just look at evaluation at the end. Really embrace it as part of the initiative so that you can have information coming in, so that you can make adjustments as you need to. Somebody, Pritpal, at our dinner last night was mentioning how even iPhone now, you buy an iPhone, that's great, and like 3 weeks later you've got this little note on your screen saying, oh, it's time for an update, because they've continuously improved their product, right? And they're like, oh, we found a bug, we need to fix it, here you go, here's another one, and another 6 months later you've got another one. And we need to really internalize that and think about how we apply that in the social sector. So the second thing is to set reasonable expectations. And that means managing expectations about results and accountability, and what kind of change you can expect and when it's appropriate to expect it. So if we know that trust in relationships are the primary thing you need to focus on in the first or second year, because if you don't get that in place, then good luck with the rest of it, then guess what? That's what we ought to evaluate in the first or second year, right? So I think it's really important to think about how you match up, and this is the alignment piece that David mentioned, how you match up what you evaluate and what your strategy is. And the last thing is to be thoughtful about your evaluation partners and make sure that when you're doing this kind of complex change work that you're looking for folks who have a history of doing that kind of work and who, in an ideal situation, know your community already. They're part of your community, they know who you are, they get it. So those are some of the key takeaways from this, and thank you very much.